بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. This is a continuation of ChatGPT involving in the radiology training, and we are continuing in this short tutorial how the ChatGPT used to evaluate the chest X-ray in part 2. We asked the ChatGPT to ask more information about reading the chest X-ray. Number 11, he gave of us specific clinical scenarios. Patient with acute dyspnea, we should assist for pneumonia, pulmonary edema, pneumothorax, etc. If patient with trauma, evaluate for rib fracture, hemothorax, and pneumothorax, mediastinal widening for vascular uh, 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 injuries, cancer screening, look for lung nodule masses, other suspicious findings, chronic lung disease, monitor the progression of the interstitial lung disease, emphysema, congestive heart failure, assess the cardiomegaly, pulmonary edema, and pleural effusion. The mutation of the chest X-ray, it is limited to for sensitivity for some condition. Overlapping structure can be obscured. Obscure finding interpretation can be subjective and variable. Complementary imaging modalities, computed tomogram, higher sensitivity for lung parenchyma involvement, pleural involvement, mediastinal abnormalities, echocardiography, better evaluation of cardiac structure and function, magnetic resonance imaging useful for evaluation the chest wall and mediastinum. Interdisciplinary collaboration between the radiologist, pulmonologist, cardiologist, and other specialists. Discuss the complex cases and share expertise, ensure comprehensive patient care. This is extended mind map covers the following key aspects of reading chest X-ray, a specific clinical scenario where the chest X-ray interpretation particularly important, such as acute dyspnea, trauma, cancer screening, and chronic lung disease. Acknowledgement that the limitation of chest X-ray, including its reduced sensitivity for certain condition and potential subjective interpretation, highlighting complementary imaging modalities such as CT, echography, MRI that can provide additional information to supplement chest X-ray finding, emphasizing the importance of interdisciplinary collaboration among the radiologist, pulmonologist, cardiologist, and other specialists to ensure comprehensive patient care and optimal interpretation of the chest imaging. By considering these additional elements, a clinician can further refine their approach and reading and interpreting their X-ray, ultimately leading to more accurate diagnosis and improved patient outcome. Continuation, we still ask the ChatGPT how to continue for the reading the chest X-ray. He give us the pitfall and errors in interpretation, technical factor, pitfalls and error, improper patient positioning, inadequate image quality, perceptual errors, failure to identify the abnormalities, misinterpretation of normal variants, cognitive bias, anchoring bias, premature exposure confirmation bias, and knowledge gap and familiarity with rare atypical findings, lack of experience with certain disease process. Quality assurance and continuous improvement, peer review and double reading, regular review cases by experienced radiologists, consensus, consist, consensus building and feedback, continuous education and training, participation and professional development activity, staying up to date with the latest evidence and guidelines, structured report and decision support, use standardized templates and checklists, incorporation of clinical decision support tools, medical legal consideration, comprehensive documentation, detailed and accurate reporting of the finding, a clear communication of recommendation, timely follow-up and communication, a prompt notification of a critical or unexpected finding, coordination with the referring clinician, risk mitigation strategies, adherence to the professional standards and guidelines, continuous equality improvement initiatives. This expanding mind map cover the following additional key aspects of the reading of the chest X-ray, potential pitfalls and errors in chest interpretation include technical factors, perceptual errors, cognitive bias, and knowledge gaps, strategies for quality assurance and continuous improvement, such as peer review, double reading, etc. Medical legal consideration include importance and consideration, comprehensive documentation, and follow-up and communication. By addressing these additional elements, clinicians can further enhance their ability and accurately interpret chest X-ray, minimize the risk interpretation errors, and deliver optimal patient care while also considering the medical legal implication of their recommendation. Thank you for listening and hoping to see you soon in another tutorial regarding ChatGPT. سبحانك اللهم وبحمدك أستغفرك وأتوب إليك.